So early on, we had community health workers. We knew we needed them, and we needed them embedded with our outpatient clinics. So that was one of our first fundings in the first year, that we funded some community health workers to be in physician offices. Love our physicians. They were not really ready to let go of some control. But my favorite is a physician that came forward after year one and went, "We did it wrong, Jennifer, and I got a better idea." And what he told us was, he said, we were having the community health worker come behind the doctor. So the doctor would go in, they would do their doctor stuff. They would come out and they'd grab a community health worker and say, "I think there's more going on with Mary. Can you go in and talk with her?" They'd go in, they'd come out and they'd say, "Doc, we got this. We got a whole list of things that Mary needs, and we're gonna get it done." Everybody was happy. One time I had an audacious community health worker that got in before the doc. Game changer. Doctor came out and he said, "I've been seeing this individual for 8 years. She's non-compliant. She doesn't understand her diagnosis. She doesn't care to feel better. She's not doing what I tell her to do." He said, "Jennifer, that day I walked into the room and I had a very different patient in front of me. The difference was that audacious community health worker that got in the door first, talked to her about housing, talked to her about transportation, talked to her about food instability. They got a plan together. By the time the doc walked in, that patient was ready to listen in a different way that she'd never been ready to listen before." We got to take care of those stressors first and not assume that we've got somebody non-compliant. But those are the system learnings, that if systems don't talk, you never get to those realizations.